Hi, I'm Shane. Today we're going to talk about, is a low-carb diet bad for your thyroid? I have researched several of the top low-carb diet doctors in the world, and I'll offer their input when they were asked the question. And we'll also, if you stick around to the end, we'll cover some more of anecdotal evidence, but I will show you some people that have truly turned their thyroid condition around by following a low-carb diet. And then I'll also have an important announcement to make at the end of this video, so stick around. The first doctor we're going to talk about is Dr. Sarah Holberg, who herself suffers from a thyroid problem. And she is one of the top low-carb doctors when it comes to this diet. And she states that there is absolutely no evidence that states that the low-carb diet is harmful for people with thyroid issues. Secondly, she says that you should continue with your blood testing as you would with any other diet, and you will typically see, as she has with her patients, a reduction in their medication because the medication is weight-based. So that's exciting news. The second doctor, Dr. Jason Fung, who is a renowned nephrologist who treats type 2 diabetics, also using the low-carb diet, stated that there is no clear evidence that your thyroid is affected by diet. And he also states that he has no concern about following keto and its impact on the thyroid. Next low-carb doctor is Dr. Ranjin Chatterjee. Now what he has found with his lady patients that follow the low-carb and have thyroid issues is that they may suffer from lethargy or from sluggishness. And he says that this isn't a reason to throw the whole low-carb thing out because you're feeling these sensations. What he recommends is that you look at individualizing your low-carb approach for the individual and then adjust it accordingly until that symptom or symptoms disappear. Dr. Kate Shanahan, what she recommends is that you have a more gradual approach for some with thyroid issues because they may suffer from extreme hunger, and she says that you need to individualize this and have a more gradual approach when following the low-carb diet. Finally, Dr. Stephen Phinney. The link that I'm referring to in this article would be posted below this video for those of you that would like to do a deeper dive on what I'm about to share with you. So Dr. Stephen Phinney opens up or says that your thyroid hormones regulate your metabolic rate. And he has looked at many studies conducted by many top-notch doctors in the world where they took groups of people and put them on a low-carb diet for 4 to 6 weeks. They took their T4 and T3 hormones prior to the study and after the study. And what he saw was that there was up to a 40% drop in your T3 hormones. And he says that what had happened there is that there is a improved sensitivity of the use of your hormones. So that means you don't need as much to keep your metabolism running. If we use the metaphor where a car is getting 10 miles a gallon and you give it a good service, i.e. increase the sensitivity as was done or shown in the low carb study, and you now get 20 miles a gallon or 25 miles a gallon, very much in a similar fashion, he says that your need for T3 and T4 hormones drops. So your body is operating at a more efficient state. And that is great news. So to summarize the first segment of this video, based on what these doctors are saying, who specialize in low-carb diet for their patients, there is no conclusive evidence that there is any negative effect or harmful effects on a person with thyroid issues or non-thyroid issues following a low-carb diet. So, next we're going to look at some examples of people that have had improvements. This is by no means evidence. This is purely anecdotal, and this is their feedback on what they've experienced following a low-carb diet. And we will do a walkthrough on each of their comments. And again, I just want to emphasize, I'm not a doctor. I'm just sharing information that I found in my research to help you make a decision on whether the low-carb diet is something that you feel would be effective for you. So let's walk through each of these 5 examples. There are many more, but for the sake of this video, I wanted to keep it short. So let's have a look. So the first one is Pam. She says that she had hyperthyroidism for 20 years. She started the keto lifestyle, was able to wean off her meds, had recent labs done, and the thyroid levels are in the normal range, and she no longer has a nodule in her neck. And she states it's amazing. Again, this is not proof that you may see or experience such results, but I'm just wanting to offer you some hope that if it's possible, well, who says it cannot be possible for you? M. She states she's been doing IF and keto, which is intermittent fasting, for nearly 4 months. She's been on Thyroid for 14 years. She saw her doctor for the 2nd time since starting and has once again had her dosage lowered. So as previously mentioned by the doctors, because the synthroids and these medications are weight-based, that is to be expected. So her benefits are amazing her. DRH stated they had their thyroid blood tests done 2 weeks ago. They're also following a keto low-carb diet for about 6 weeks. And for the first time in 20 years, the doctor is decreasing their thyroid meds because the T3 is getting too high. So you can see here they've lost weight. There's a medical, or the doctor has adjusted her medications downwards, which is to be expected. She also said that she's hoping to lose 30 kilograms. So not bad, 60 years old. The next one, Andrew, he's totally quit Synthroid and is able to keep his T4 in the range of the higher part of normal on keto. And after 18 months on keto, his labs came back perfect. His cholesterol, he's had benefits in cholesterol as well. Finally, Jenny, she said, I only have half her thyroid, and when she does her keto, her blood work improves, and also the inflammation markers go down significantly. So let's summarize. There's been no evidence based on several doctors who focus and specialize in low carb that your thyroid is harmed by following a low carb diet. What you have seen is the comments of people saying that they have had a reduction in their medication, or they've had a total turnaround based on following a low carb and intermittent fasting lifestyle. This is not a guarantee you will have the same benefits, but I wanted to give you an injection of hope that if it's possible for somebody else, who knows, it might be possible for you. Finally, I just want to quickly announce I have a few spots opening up on my coaching program for those of you that want to lose unwanted body fat. And let's connect. I will put a link below the video and see if we'll be a good fit to work together to help you reach your targets. Thank you.